You've been treating toilet infection, and this doctor on YouTube is asking whether toilet infection exists. Give me a minute, I can explain. Hi, fam, welcome back to my channel. In case you're new to the channel, hi, my name is Dr. Ada. You're very much welcome. Let's just go straight into this video because there's so much to unpack. So, what is toilet infection? There's actually no medical diagnosis called toilet infection. A better term will be vaginal infection. The term toilet infection came about because most people attributed the symptoms they were having, that is what they are feeling in their body, to be as a result of dirty toilets. But if you're honest with me, you would know that you've been using clean toilets, you've been making sure that even if you're using a public toilet, you put tissue, you make sure that it's very clean. In fact, sometimes you carry your pee home because you don't want to use dirty toilets, yet you still keep having this infection. So you see, it is not actually from the toilet. Now, what are the various things that people actually call toilet infection? Number one is a urinary tract infection. Number two is a sexually transmitted infection. Number three is candidiasis, and I'm going to be explaining all this in this video. The first is the urinary tract infection, which is essentially an infection of the urinary tract that is moving from the kidneys down to the bladder into the urethra, which is where the urine comes out from. Some of the things that you might feel in your body that might mean that you have a urinary tract infection, that is a UTI, might be that, oh, you feel pain when you pee, or you feel a burning sensation or some pain in the lower part of your tummy while you're peeing, or you feel some pain by the sides of your tummy, or even that you pee frequently. You notice that maybe you used to pee 5 times in a day, and now you're peeing 10 times in a day and 5 times in the night. Kai, it might mean that you have a urinary tract infection. Another thing that could also be happening is that if you feel like, oh, if I want to pee and if I don't go now, I'll pee on myself, that might be a point at urinary tract infection. Now, other things you could also find is fever, vomiting, depending on how severe this thing is. Second thing, which is where I'm going to dwell on, is what I would title vaginitis. Why I'm using vaginitis and not vaginal infection is because this feeling could be as a result of an infection, which means that there's actually a microorganism, whether it's a bacteria, virus, or whatever, that is the cause of these feelings that you're having. Or it could actually be non-infectious. That means that there is no microorganism involved. Let's start with the non-infectious. The non-infectious could be as a result of reaction to things. Maybe you're using a pad that your body is reacting to. So sometimes you notice that after your period, you have this rashes around your private area, you're having itching around your private area. Yes, it could actually be your body reacting to this thing. Another thing you could also be reacting to is soaps, including the soap that you use to wash your undies or the detergent that you're using to wash your undies. If they are very harsh and you don't rinse out properly, you don't rinse out the undies properly, you could actually be reacting to these washing materials. The other thing you could be reacting to is even the undies themselves, their materials. Some people react to silk. Some people, once they wear cotton, some people, when they wear linen, they are having rashes everywhere. You will notice that it will not just be in your private area that you have this. Usually, when you wear these clothes, you can have these reactions. You notice that some people, when they wear leather, you see some people that say, oh, they don't wear leather watch because once they wear leather watch, they have rashes around. It's the same thing that is happening there. So it could actually be the material of your undies that you're reacting to. Now, getting down to the infection, which is the meat of the matter, there are various types of vaginal infection. Let me start with the commonest one, which is the yeast infection, aka candidiasis. So, as a woman, you start to have this creamy whitish vaginal discharge that doesn't really have a bad odor, but then it doesn't really smell good as well. It might be a sign that you have vaginal candidiasis. And you could also have itching as well. That is one example of an infection. Another one that I'll also be talking about is what we call vaginosis. How does this come about? It's that you've altered the balance of the private area. Now, the private area has a very strict balance. It is acidic and it has good bacteria. So when you do things that alter this balance, including using soaps in your area, you should not be using soap to wash your area, and even taking a lot of antibiotics, you alter this balance. You tend to have this vaginosis. So you have a discharge that is creamy, it's milkish, it has a fishy odor. That might be a pointer that you have vaginosis. It could also be itchy as well. Now, I'll be going into these things that you could do to alter the balance of the vagina in another video. So make sure that you subscribe and turn on your notification bell so that you don't miss that video when it comes out. The final type of infection is, of course, the sexually transmitted infection, popularly known as STIs, right? So there are a wide range of them. So you have discharge, it can be brownish, it can be greenish, it can be yellowish, it can be whitish. Sometimes it's really thick, other times it becomes so watery. In fact, some people have discharge that is so bad that they would need a pad because of the discharge that they're having. Yes, it can get that bad. The discharge is usually foul smelling, you can have itching, you can have rashes, you can have burning sensation when you have intercourse. These are the things that point to a sexually transmitted infection. So you see that there are so many things that people call a toilet infection, right? It's not from the toilets, like I've said before. Now, that's not to say that you should be putting your bum bum inside inside unclean toilets. Abeg go, don't do that. It won't even feel comfortable, in my opinion. It won't even feel comfortable. But no, that's not the reason why you're having this infection, this vaginal infection. I've come to the end of the video. If you liked it, please press the like button, leave a comment so that this video gets to more people and more women and men. Yes, because men too can have infections. Get to see this video. And thank you so much for watching. As always, stay healthy and I'll see you in the next video. Bye.